All right. Um, Good morning, everyone. I think we shall get started. My name is Tang from the School of Pharmacy, Monash University, Malaysia. I will be the host for this oral presentation session. So there are 6 presenters in this session. Each presentation will last for about 7 minutes, followed by 3 minutes of Q&A. For your information, the live Q&A session after each talk is only open to judges. However, if you have any questions from the audience pertaining to any of the talks in this session, please feel free to type your questions in the Q&A box. And I encourage all presenters to check the Q&A box after their presentation and reply to those questions from audience. Before we get started, let me introduce the judges for this session. We have 2 judges here, Professor Igor Iziza from International Medical University, or IMU, and also Associate Professor Wan Amir from University Science Malaysia. So first, let me introduce our first speaker here. Our first speaker is Siti Zaleha Raduan from IIUM. So we will play the first video clip.
Assalamualaikum and a very good day to all of you. My name is Siti Zaleha Raduan. I'm from Kuliah of Pharmacy. I am Kontan campus. Today I'm going to share with you my findings regarding on phytochemicals composition and antioxidant properties on bark of Litsea garcae. The objectives of this study is to evaluate the phytochemical composition of algae barkroot extract, where hexane, chloroform, methanol, and aqueous, based on the phytochemical screening, secondary metabolite profiling, and antioxidant measurements, and also to identify the highest antioxidant activity of algae barkroot extract via in vitro antioxidant capacity assessment. Litsea garcae Vaidheswary is a native plant in Sarawak and commonly known as engkalap. It is also endemic to southwest Sabah, Kalimantan, Philippines, and Taiwan. The Sarawak tribes are traditionally using various parts of the plant to treat different ailments. The Litsea garcae bark was collected at the local area of Sibu and with the permission of Sarawak Biodiversity Center. The coarse dried powder of bark was macerated successively with respective solvent according to their increasing order of polarity. The percentage yield was calculated with the highest extraction yield was in methanol. As for phytochemical composition, phytochemical screening was performed, and secondary metabolite profiling was done through RP, UHP, LC-MS analysis. And this is the result for phytochemical screening. And 48 compounds were detected for hexane, meanwhile 29 compounds for chloroform, 35 compounds for methanol, and 36 compounds for aqueous extract. As for the antioxidant measurements, total phenolic content and total flavonoid contents were formed. As for the result, the methanolic extract possessed the highest TPC, and meanwhile chloroform with the highest TFC. As for antioxidant capacity assessment, FREP and DPPH assay were performed. And this is the result of PrEP and DPPH assay. In PrEP assay, all extract possess a very low of antioxidant capability. Meanwhile, in DPPH assay, methanolic extract has the lowest IC50 comparing to the standard ascorbic acid. And this is the correlation between TPC and antioxidant capacity with the significant negative correlation between TPC and DPPH. Methanolic extract possesses the highest TPC. This is aligned with the preliminary screening result, which has the positive phenol and tannins. Meanwhile, in LCMS, there were varieties of phenolic compounds detected, and all of above results contribute to the lowest IC50 in the PH assay. Meanwhile, for TFC, methanolic extract had the high TFC. This is aligned with the preliminary screening result of positive flavonoid. In LCMS, there were 2 flavonoid compounds detected, and all of above results contribute to the lowest IC50 in the PPH assay. This is all of the structure of the compound detected, phenolic compound detected in methanolic extract. And hence, it suggests that phenolic and flavonoid groups are highly responsible for the Litsia-Garcia-Bach extract antioxidant activity. As for the antioxidant capacity assessment, there are some issue on the FREP assay method. This FREP was poor correlation to the TPC. The FREP assay was measured only the reducing capability based upon the ferric ion, which is not relevant to antioxidant activity mechanistically and physiologically. The result can vary tremendously depending on the time scale of analysis. As you can see in the LCMS, they were detected one derivative from ferulic acid. This acid will may contribute to the long reaction of the FREP assay. And the interference of the color of some extract and also slow development of colors also contribute to the problems in FREP assay. Meanwhile, in DPPH assay, all extract possess the DPPH radicals scavenging effect. Methanolic extract has the very lowest IC50, indicate high scavenging activity. Methanolic extract comparable with ascorbic acid. In hexane extract, the highest IC50 indicate low scavenging activity. So the DPPH radical scavenging activity is strongly affected by the number of phenolic compound. And in summary, in the presence of phenolic compound in plants contribute significantly to their antioxidant potential. Alkaloid detection through LCMS may contribute to the significant antioxidant activity in the methanol extract because apropine alkaloids possess pharmacological activity, in example, antioxidants. Okay, as for the conclusion, the antioxidant capacity assessment indicate that methanolic extract with a high TPC and TFC could be a significant natural antioxidant source. The recent study provided novelty of proposed compound data through LCMS analysis for all 4 extracts, with the 5 major phenolic compounds detected in methanolic extract. The presence of alkaloid detected through LCMS in methanolic extract may contribute to its antioxidant properties, including bethleoline, etriolene, and chlorine. That's all. Thank you.
All right. So, Siti, can please get ready for the questions from first from Professor Iziza.
Thank you very much, Zaleha. I enjoyed much with your presentation. Very comprehensive study, a lot of results. Just to clarify a few points, the object of your study was bark, right?
Yes.
Yes. Okay, yes, but in the title, somehow eatable fruits. You know, this was a bit like misleading, the title. So I was thinking at the beginning that is what about.
Sorry. As far as I know.
Sorry, it's my mistake. Yeah, it's bark. So my question is, is any other study where the different part of the Lycia garcia was compared, like the bark, leaves, fruits, and why you chose the bark? Because it has the more higher antioxidant potential, or why you chose the bark in your study? Other part of Lycia garcia was studied before, or?
Yes. Okay, Prof. Before this, as a previous study showed that a various part of this Lycia garcia has been shown as an antioxidant, and why I choose the bark part is because the main part of my study is regarding on the neuroprotective effect of bark part of Alzheimer's disease. The choice of the this part is mainly based on the previous study, which bark part is detected to be potential as M2 antagonist. So as we know that selective M2 antagonist is maybe useful in treatment of Alzheimer's disease. Additionally, genus Lycia also found to have an appreciable amount of acetylcholine esterase inhibitors.
Okay, and one more question. So sometimes in vitro studies not correspond to the in vivo study. So whatever we are getting from the in vitro study, we have to confirm, to reconfirm in vivo study. So my question is, are you going to confirm antioxidant properties of Lycia garcia in vivo using some models of oxidative stress in animals?
Yes, Prof. Because as I mentioned earlier, I will be continue this study for neuroprotective effect. Thus, I will be check for the lipid peroxidation and oxidative stress for this methanolic extract, the highest antioxidantivity among the extract, and that's my plan.
Okay.
All right. Thank you, Siti. Is there any question from Prof. Wanami?
Okay, Siti Zaleha.
Yes.
Very nice presentation, basically, but it's full of results. Okay, I think you have done a lot of what I call methods, a lot of study on this. Just wonder, so are there any sort of like a comparison between different extracts? Say, for example, you are using the methanolic, isn't it?
Yes. I'm using 4 types of extract, comparing 4 types of it.
Okay, so but in this case, you found out that methanolic is
the very best one.
Okay, just comment on your
yes.
It's just that maybe perhaps in before you proceed telling about this antioxidant and everything, maybe perhaps you put before why actually you study this plant, because I just know that why you study this plant because you're going to further on the Alzheimer's.
Yes.
You know what I mean? So just a little bit of comment. It's just that perhaps maybe next time, just before you proceed with all the results, maybe you justify why actually you study this plant.
Okay, Prof. Thank you.
Well presented, Siti. A lot of comprehensive phytochemical analysis. Okay, well
thank you, Prof. All right.
Okay, thank you, Siti. So our next speaker is Raveena Muralitharan from the University Kebangsaan Malaysia.
A very good day and to everyone. My name is Raveena and I'm from UKM, and today I'll be presenting our research entitled Cytotoxic Effects, Antioxidant Capacity and Collagenase Content of Bedak Sejuk, also known as cooling powder made from Oryza sativa subspecies indica and Oryza sativa subspecies japonica on UVB-induced B164A5 melanoma. Moving on to the introduction, the photo shown here is the commercialized version of Bedak Sejuk. And Bedak Sejuk is traditional fermented rice-based cosmetic in the form of water droplets or cone-shaped pastils. And when these pastils are mixed with water and applied on the skin as an overnight facial mask, it produces this cooling effect. And Bedak Sejuk has been said to promote beautiful skin as well as facilitate skin whitening. For this research purpose, we made our very own Bedak Sejuk using the method by Zulupaka et al., whereby 1 part of rice grains is soaked in 1 part of tap water and allowed to naturally ferment at room temperature. After 12 weeks of fermentation, the resulting rice paste is then put into the oven for drying, which results in this powdered version of Bedak Sejuk as shown here. And for this study, we made two types of bedak sejuk, which are from the indica rice grains as well as the japonica rice grains. Moving on to the research justification, this is our skin. Our skin is subjected to a multitude of environmental insults, including UV radiation from the sun. And when there's increased UV radiation, it results in decreased skin antioxidant defenses, as well as the breakdown of the skin extracellular matrix due to increase in matrix metalloproteinases, MMPs, such as MMP1, which plays a major role in collagen breakdown in the skin. And with this accumulating damage due to UV radiation from the sun, it will ultimately result in skin cancer. And one form of skin cancer that I would like to highlight today is melanoma. Although melanoma accounts for less than 10% of skin cancers, it still accounts for a majority of skin cancer-related deaths due to its high metastatic potential as well as its resistance towards therapy. And this brings us to the investigation of bedak sejuk made from indica and japonica rice grains as a potential chemopreventive agent. How so? By using UVB-induced B16-4A5 melanoma as a model that resembles normal skin cells. But then again, why use bedak sejuk? Well, to date, the benefits of bedak sejuk are only backed up by generations and generations of usage as well as testimonies. So there could be some truth behind the testimonies of bedak sejuk in improving skin health. Moving on to the research question, does bedak sejuk gives effects towards UVB-induced B16-4A5 melanoma cell viability, as well as possessing antioxidant capacities and the potential to decrease MMP1? The research hypothesis is bedak sejuk gives effects towards UVB-induced B16-4A5 melanoma cell viability, as well as possessing antioxidant capacities and the potential to decrease MMP1. As for the objectives, firstly, to determine the optimum dose of bedak sejuk on UVB-induced B16-4A5 melanoma, secondly, to determine the antioxidant capacities of bedak sejuk, and thirdly, is to determine the effect of bedak sejuk towards the collagenase MMP1 content of UVB-induced B16-4A5 melanoma. As for the methodology, firstly, the B16-4A5 cells were cultured, followed by carrying out the cell growth curve to obtain the doubling time of 24 hours. Then the cells were UVB irradiated with 30 millijoules per cm square. And then the MTT assay was carried out for bedak sejuk dose optimization, whereby the cells were UVB irradiated. This is followed by the FRAP assay to identify the antioxidant capacities of bedak sejuk. And finally, to determine the MMP1 content using the ELISA kit, whereby the cells were also UVB irradiated. This is followed by statistical analysis. Moving on to the results and discussion, firstly for the MTT assay, the graph shown here is from the positive control menadione. And what we can see here is each tested concentration of menadione was significant when compared to the negative control. And an IC50 was obtained, which was 0.04 plus minus 0.02 millimolar. But with bedak sejuk, surprisingly, there was no IC50 obtained, and hence no cytotoxic effects. In fact, the results were not significant when all the tested concentrations were compared to negative control. Hence, the higher the dose of bedak sejuk, the higher the cell viability of B16-4A5 melanoma. In this case, this is desirable because, like I've mentioned previously, this is a model that resembles normal skin cells. And we use cancer cells because it multiplies and proliferates faster, and at the same time, it has an increased cell activity and cell metabolism, which is further induced by UVB. Plus, we are looking at the chemopreventive effects, not the anti-cancer effects. With that, two of the higher doses were chosen, which were 50 and 100 grams per liter, because at those two doses, the cell viability were at its highest, and that is the desired effect that we want. Hence, these two doses were chosen for the FRAP assay. Moving on to the FRAP assay, the graph shown here are the FRAP values of the indica and japonica bedak sejuk, and the values were expressed as ascorbic acid equivalent antioxidant capacity in the unit microgram ascorbic acid per gram of bedak sejuk. And as shown here, japonica bedak sejuk at 100 grams per liter was significant when compared to other treatment groups. This can be explained by the fact that japonica rice grains are cultivated in colder temperature, making their antioxidant activities more pronounced. Hence, in general, 100 grams per liter of bedak sejuk was then chosen for the MMP1 assay because higher doses showed higher antioxidant capacity. Moving on to the MMP1 content, it can be seen here that the results are not significant when compared to negative control, and the results were also not significant when the treatments were compared with each other. Hence, both types of bedak sejuk did not decrease the MMP1 concentration. But a study by Lee et al. Found that this traditional medicinal mushroom decreased MMP2 and MMP9 in B16F10 cells, another variant of B16. So for future studies, probably we could consider MMP2 and MMP9 to be investigated. In conclusion, Japonica bedak sejuk has a higher antioxidant capacity compared to Indica bedak sejuk, making it good for skin health. Both types of bedak sejuk did not decrease MMP1 levels, and further investigations are needed before Indica and Japonica bedak sejuk could be developed as potential melanoma chemopreventive agents. Here are my references. And as for the acknowledgements, I'd like to thank the Chemoprevention Research Team, as well as the Faculty of Engineering and Built Environment, FKAB UKM, for their previous research on bedak sejuk. With that, thank you.
Thank you, Raveena. Questions from judges? Prof. Iziza?
Thank you very much, Raveena. Thank you for your study. It's very interesting and a lot of the new data. I have a few questions to clarify. The first one, so the high dose of bedak sejuk shows the cell viability of melanoma cells. And in the first graph, if I'm not mistaken, it showed that the higher than 100%. So does it mean that tested compound increased proliferation of melanoma cell?
Yes, the tested compound does increase the proliferation of melanoma cells. But in this case, we can't say that bedak sejuk would increase melanoma cell proliferation. In fact, we should look at it at a different angle. Like it has antioxidant potential to promote cell proliferation. So we can actually see that these results could be, in a way, replicated in normal skin cells as well.
Okay, and one more question. So before I was taught that the main component of bedak sejuk is starch. Maybe I'm wrong, just correct me. And also the which component of the chemicals in the bedak sejuk is responsible for the antioxidant capacity?
And what compounds? There hasn't been like, how would I say, like, there hasn't been like a study which actually analyzes the components of what is inside bedak sejuk. But then as far as I've known, it's made out of carbohydrates. And then there's also amino acids that promote skin health. So I would concede to the fact that further studies are needed to be carried out to identify the components of bedak sejuk, and from there we can see what particular component promotes its antioxidant activities.
Oh, okay, thank you very much.
Prof. Wanami?
Okay, Raveena, don't let the information leak because it's going to increase the price of bedak sejuk. Okay. By the way, Raveena, did you process your own the bedak sejuk, or you sort of like get it from outside or somewhere?
Oh, okay. Actually, this bedak sejuk was made in the engineering faculty. What they did was they bought rice grains from the supermarket. Then just basically one part of rice grains is soaked in one part of tap water, and then it's just allowed to naturally ferment in normal room temperature.
So it means it's produced by your team lah.
Yes.
Okay, then go back to the just referring back to the question by Prof. Igor about when you did your MTT assay. So did you test on any other cells rather than just on melanoma cells?
Just melanoma, but then for like future students, they are really testing it on like hard cut cells, which is actually immortalized human keratinocytes. Okay. So yeah.
Because it's quite dangerous for you to conclude, especially when referring to Prof. Igor's question, because it seems that it did not kill the melanoma cells. So that's why I think the result should be what they call carefully interpreted.
Carefully interpreted.
The result shows that actually it's promote the growth of melanoma cells. So that's what you are not intend to do, isn't it? You don't want to promote the melanoma cells. I know that what you mean. You mean that should be interpreted by but in the first glance, there is a what they call as we say that dangerous results actually, because it seems that it's promote the melanoma cells. In other way, again, just wonder that, so means that, okay, so there are no sort of like what they call study has been done on the compounds on anything on this bedak sejuk, isn't it?
Yes.
Okay, so do you suspect which component in the bedak sejuk actually that can contribute to these effects? You say there's a lot of carbohydrate and etc. etc. So what actually, what do you sort of like forecast, or what do you think the component in bedak sejuk that can contribute to these effects?
What sort of component?
Yeah, compounds or content of bedak sejuk that might contribute to these effects on melanoma cells.
Okay, so the thing about this bedak sejuk, it's fermented, and the thing with fermentation, this fermentation is due to microbes. So when the microbes ferment the bedak sejuk, then what happens is we get these amino acids and so on. So there has been previous studies on the amino acid content, also the fatty acid content, that there were high levels of, if I'm not mistaken, I forgot what amino acid was it, but there were amino acids which were found that could contribute to skin health, and these amino acids were even used in already pre-existing cosmetic products. So probably that is what, if those amino acids are already promoting skin health, then those things also can be said to have antioxidant potential as well.
Okay, thank you, Raveena.
Thank you, Raveena.
All right.
Thank you.
All right, thank you for the questions.
All right, let us move on to our third speaker, Bedanta Roy from Quest International University, Perak.
Hello everyone, I'm Dr. Bedanta Roy, Senior Lecturer in the Department of Physiology from Quest International University, Ipoh, Malaysia, presenting our research entitled Physical Activity and Emotional Intelligence, Finding the Relationship Amongst the University Students in Malaysia. This is my pleasure to participate and present in the MSPP 34th Scientific Meeting 2021. Let's start the presentation with the background. All of us know that physical activity, PA, is an integrated part of physical, mental and social wellness. PA is the movement of the body by the skeletal system, which we do every day. PA improves psychological wellness and helps to overcome stress, anxiety and depression. Ample research in different age groups involving teenagers, college students and old age groups documented this correlation very well. According to World Health Organization, global recommendation on physical activity for health, at least 150 minutes of moderate intensity physical activity throughout the week, or 75 minutes of vigorous intensity physical activity throughout the week, or an equivalent combination of moderate and vigorous intensity activity accumulating at least 600 minutes per week needs for the adult age group 18 to. Immediate benefits of PA are improved cognition, reduced acute anxiety, improved sleep and weight management. Interestingly, regular PA is a tough challenge for the undergraduate students because of academic activities. A meta-analysis on undergraduate students showed that PA is half of the actual requirement for the age groups. Now moving into the emotional intelligence, or EI, is the ability to perceive, accurately appraise and express emotions, generate feelings when they facilitate thought, understand emotion and emotional knowledge, and regulate emotions to promote emotional and intellectual growth. So EI is related to the achievement of career success. An increase in EI score is directly proportional to the well-being and happiness, enhanced performance. So higher EI score is linked with good habits such as avoidance of smoking and also drinking. Females have significantly higher levels of EI compared to males, and there is an increase of EI progressively along with the age. EI and PA is closely related. Studies are deficient from Malaysia. A previous study by Kumar et al. Amongst the university staff showed that a positive correlation between PA and EI. Hence, this research aims to study the relationship between PA and EI among undergraduate students at QIU. Let's move into the material and methods. This online questionnaire-based cross-sectional study was done on 149 undergraduate students. We used 3 questionnaires: Global Physical Activity Questionnaire for the PA level, Trait Meta Mood Scale TMMS 30 for EI measurement, and a socio-demographic questionnaire. Ethical committee approval was also taken before the study. GPAQ focuses activity at work, travel, recreational activities, and sedentary behavior. 4 mates and 8 mates were considered for the moderate and vigorous activities. In TMMS 30 items, they are scored on a Likert type scale of 5 points within 3 components: ATF, CDF, and MR. The data were analyzed by SPSS. A descriptive analysis was performed. An independent t-test and a Mann-Whitney u-test was performed. Eta squared was used to estimate the effect size. Spearman's correlation analysis was used to find out the relation between EI and PA. Now we shall look at the results of the study. Table 1 represents the demographic data. Majority were female, 67.8% were studied medicine. Indians were 52.3%, followed by the Chinese 24.2% and Malay 6%. In table 2, participants showed an average EI of 101.97, among which an average 36.007 was scored in CDF and mean 44.12 in ATF and 21.846 in MR. Meanwhile, in PA, the mean was 4038.4 MTS, where 74.5% was physically active. Table 3 depicts Spearman correlation of domains with EI and PA. Mood repair, a component of EI, was significantly associated with PA with a Spearman row of 0.172. It's a weak positive association, and overall EI was significantly associated with PA, which is also a weak positive association. Table 4 shows a descriptive summary of the EI dimension according to the gender. Women scored significantly higher in the ATF component of EI as compared to men. In contrast, the other component had a negligible and insufficient difference between both genders. Now look at table 5, which shows a descriptive summary of PA calculated in mates according to the gender. Although no significant difference between both genders were found, men seem to have a higher level of PA compared to women. In contrast, women seem to be more physically active, 75%, as compared to men. So as a conclusion of this study, we can say that physical activity boosts mental health, which is reflected as an improvement of emotional intelligence in the study. Although the relationship discovered is relatively small and PA's predictive power of MR and overall EI is relatively low, still outcome of this study will help to implement the health practice and policy, especially in higher education sectors. These are my references. We are thankful to Quest International University, the participants, and also Community Medicine Department who helped us in this research project. Thank you for your time.
All right. So unfortunately, Dr. Bedanta Roy unable to join us for this to answer the Q&A session. We just move on to the next speaker now. Syahidah Hisam from University Kebangsaan Malaysia. Oh, sorry, is Mr. Ravi Sheshala from UITM.
Good morning all, this is Dr. Ravi Sheshala from University Technology Mara UITM Punchalam campus. Today I am presenting my research work on the topic of formulation and characterization of chitosan beta-glycerophosphate thermosensitive in situ gels for accurate delivery of long-phlogisine hydrochloride. Brief introduction about the structure of the eye. Eye is very delicate organ in the body and also important organ for the vision. It is having a spherical in structure with a diameter of 2.5 centimeter. Eye is divided into two segments, anterior segment front part of the eye, which is comprised of cornea and conjunctiva, iris pupil. Posterior segment back part of the eye, which is comprised of sclera, choroid, macula and optical nerve. There are several common eye diseases classified into anterior segment and posterior segment diseases such as conjunctivitis, barley eye, dry eye syndrome, glaucoma, which can occur for different reasons and different causes. To treat these disorders, having a number of dosage forms in the market such as eye drops, ointments, suspensions and gels. About 90% of the dosage forms are available in the form of eye drops. But these eye drops are associated with several disadvantages such as short residence time due to dilution with tear fluid and blinking reflex mechanism of the eyes, rapid precorneal drug elimination, nasolacrimal drainage which can leads to the systemic absorption and systemic side effects, high frequency of dosing administration. Only 20% of initial dose is retained in the ocular surface which causes the low bioavailability and poor patient compliance. To avoid these limitations of eye drops, in situ gels were prepared, which is also known as smart eye drops. They are smart in action, not in appearance. These eye drops, when we prepare it, will be in the solution form at room temperature. Uh, but it utilizes the ocular environment such as temperature, pH of tear fluid, and ions present in the tear fluid, and transit from the solution to the gel at ocular environment. So this is called solution to gel phase transition. Objectives of the research: to formulate thermosensitive in situ gels containing antimicrobial drug lomflaxine using a combination of chitosan and beta-glucurophosphate, characterize those formulations in terms of appearance, pH, viscosity, solution to gel phase transition, and in vitro drug release studies. A total of 5 formulations were prepared. F1 formulation without beta-glucurophosphate, only chitosan is used at 1.5%, and F2 to F5 formulations added beta-glucurophosphate at 10 to 40%. Benzalkonium chloride is used as a preservative, sodium chloride as a isotonic agent, PBS was used as a vehicle. In situ gels were prepared by cold dispersion method by dissolving chitosan 1.5% in lactic acid and left at room temperature overnight. Beta-glucurophosphate was prepared at a concentration of 10 to 40% in a cold phosphate buffer pH 6.2. Beta-glucurophosphate solution was added dropwise into chitosan solution and stirred until get a clear solution. Thereafter, drug and the remaining excipients were added to above mixture and stirred until get a clear and homogeneous solution and stored at 4 to 80 degrees centigrade until further use. In situ gels were characterized for appearance and clarity against black and white background. pH was measured using pH meter. Content uniformity was determined by 1 ml formulation dissolving in a simulated tear fluid pH 7.4 and measured the absorbance using UV visible spectrophotometer at 281 nanometer. Viscosity was measured by variometer with spindle CC17 at a shear rate of 0.012 100 mm per second. Solution to gel temperature was measured by the tube tilting method. 1 ml of formulation was taken in test tube and placed in water bath at 25 degrees centigrade and increased the temperature gradually until the formulation turned into the gel form without any flow and recorded the phase transition temperature. In vitro release studies were carried out by dialysis membrane method with molecular weight cutoff of 3000 Daltons. One end of the dialysis membrane was opened and filled with 1 ml formulation. Two ends were tied, placed in beaker containing the dissolution medium STF pH 7.4, placed in a shaker water bath at 37 degrees centigrade 50 rpm. At predetermined time intervals, 1 ml of the sample was withdrawn and analyzed using the UV visible spectrophotometer at 281 nanometers. The results and discussion: prepared in situ gels were appeared as clear and homogeneous. This is the picture of solution to gel phase transition of the formulation 5, which exhibited at 35.8 degrees centigrade. All formulations were found to be clear and free-flowing in nature. F1 formulation is having pH 4.39 due to the acidic nature of the chitosan. After adding the beta-glucurophosphate, the pH is turned towards the basic side, 6.94 to 7.51. F1 formulation did not exhibit any phase transition because chitosan is a pH-sensitive polymer. Once added the beta-glucurophosphate, it turns from the pH-sensitive to temperature-sensitive polymer. and exhibited F4 and F5 formulations exhibited phase transition at ocular region 33 to 37 degrees centigrade. The content was found to be 98.66 to 99.3. Formulations exhibited low viscosity before gelling and high viscosity and after gelling, which is required for the formulation, because when they are having the low viscosity, it is easy to install into the eye. Once it is installed into the eye, it uses the temperature in the ocular surface and convert into the gel form and increase the viscosity, which is required to reset the formulation for longer time at the ocular surface and sustain the drug release. F4 and F5 formulations tested for in vitro release studies, and F5 formulation with a high beta glycero content 40% sustained the drug release for 8 hours with low initial burst compared to formulation F4 with T50% of 3.39 hours. The release data fitted into various kinetic mathematic models, and they exhibited zero-order release pattern and non-frequent diffusion. In conclusion, F5 formulation exhibited solution to gel phase transition at ocular temperature, and they can reside for longer time at the ocular surface and sustain the drug release for 8 hours, which can reduce the dosing frequency and improve the patient compliance and convenience. And this formulation can be a viable alternative to existing commercial eye drops. These are the references used in the preparation of this presentation. Authors would like to express their sincere thanks to UITM for providing the research grant and laboratory facilities to carry out this research. Thank you very much.
Thank you, Ravi. Now I open the floor to questions from judges. Prof. Iziza.
Dr. Ravi, thank you very much for your presentation. Have a couple questions more related to the pharmacology rather than pharmacy. Could you please clarify, when I was talking about the ocular delivery, what do you mean? Is delivery to anterior or posterior segment of eye, or you just aim to increase the corneal retention of pharmaceuticals, which you or for pharmaceutical which you just now created? I mean, what will the aim? Is to increase the retention, corneal retention, or is to increase the delivery of the compound to anterior segment of eye?
Okay, thank you very much, Professor. Actually, any conventional eye drops will have the problem of easy drain from the. Once we instill into the eye, immediately it will be drained off. So there will be not much contact with the ocular surface. The in situ gelling system is mainly aimed for the anterior segment. With the anterior ocular infections. So as these conventional eye drops is having the problem with the immediate drain after installation into the conjunctival sac, so there is not much drug is available the ocular surface. So it cannot give the proper therapeutic outcome. So that's the reason we have prepared the in situ gelling system, which can be, when we prepare, it will be in the form, but once we administer into the conjunctival site, will be converted into the gel. So it will be a longer time at the ocular surface. Whenever it is retaining for the longer time at the ocular surface and contact with the conjunctival site, so the drug slowly releases the gelling system and it will be available for the surface. So it can treat the infections effectively. So that is the main aim of this research.
So okay, Ravi, Ravi, one more question. I'm going to test the bioavailability of your bioavailability of the formulation in vivo.
This formulation is not yet tested in vivo. Now we are conducting the antimicrobial studies. So how efficiently it is killing this bacterial conjunctivitis and blearitis and keratitis and corneal ulcers. So thereafter, we have a plan to conduct the in vivo study to determine the bioavailability. But we are as ocular research in Malaysia is not that much, so we are looking for a suitable collaboration in Queen's University, Belfast, to conduct the bioability studies. So maybe once we have that data for the antimicrobial studies, then we will proceed with the in vivo if the collaboration is happened between the two universities. So we are trying at our level best to conduct the in vivo studies to determine, to see the in vivo efficiency of these in situ gelling systems.
Okay, thank you.
Thank you.
Next, Prof. Wan Amir.
Okay, Ravi, thank you for your presentation. Just wonder, I assume that this
Hi, Prof.
Stabilization has been done, the stabilization study has been done in vitro only, isn't it?
Pardon?
Their study, the stability study, is only been done in vitro, and I think as Prof. Igor said just now, you already answered basically is in vitro study, isn't it? So do you expect that when you are...
Yeah, it's an in vitro study, yes.
Okay, so when you are, say, will you expect that when you are being used on human or in fact in the animal, would you expect that the stability is going to be the same, or is it going to be changed? Because it's going to be, you know, the absorptions and also the interaction between the, what they call body fluids. So do you think that the stability also is going to be the same?
Yeah. So test this one prior to going to the in vivo study. We want to check it in the in vitro in vitro rabbit corneal epithelium to see the stability of this this in situ gelling system. At the same time, how efficiently it is working in the in vitro level. If we are having the positive results at this stage, then we will go into the in vivo system. As of our knowledge and based on the literature, so far in situ gelling system using this combination of this thermosensitive or pH sensitive or enzymatic sensitive polymers is not having any stability issues. As in situ gelling system is in the solution of interaction with the ocular surface and interaction with the mucosa, ocular mucosa. So we assume there not much stability or compatibility issues. But to avoid this dilemma before going into the in vivo, we would like to test in the in vitro corneal cells. So then we can have such incompatibility issues arises between the formulation and the corneal epithelium, then we may have chance to revise modify our formulation to avoid that interaction between this ocular surface and the chemicals present in the formulation. So later we can move on to the in vivo study, so where we can have less stability issues or no.
Okay, right. Thank you, Ravi. So we should move on.
Thank you very much.
Our next speaker, No Syahidah No Hisam from University Kebangsaan Malaysia.
The potency of navitoclax in modulating the viability of human umbilical vein endothelial cells. For the introduction, a pathological angiogenesis is described as an aberrant modulation and coordination of angiogenic signal, which then lead to the development of involution and disorganized vessels. These vessels are often leaky and can allow the infiltration of blood constituents, hence driving to several pathological conditions such as tumor metastasis, choroidal neovascularization, and recently has been reported to induce blood instability. The pathological angiogenesis shares many processes with physiological angiogenesis, where these processes are developed in response to hypoxia and increasing demand for nutrients. They are modulated by various angiogenic factors such as VEGF. VEGF will stimulate angiogenic cascade, including endothelial cell proliferation, chemotaxis, and vascular permeability. The angiogenic activity attributed to VEGF may be due in parts to its ability to enhance the endothelial cell survival by upregulating BCL2 pro-survival protein expression. This suggests a synergistic interaction between BCL2 and VEGF signal in inducing a potent and sustained angiogenic response. Next, navitoclax has been reported as an effective pro-apoptotic agent against various cancer cells by targeting the pro-survival proteins of BCL2 family. It has high affinity towards BCL2, BCLXL, and BCLW proteins, which can induce the caspase activation, hence leads to the cancer cell death. Nevertheless, navitoclax's effect on the endothelial cells activity remains obscure due to a limited cytotoxicity profile of navitoclax on primary endothelial cells. Hence, this study aims to evaluate the navitoclax cytotoxicity through its potency to inhibit the survival of human umbilical vein endothelial cells (UVEC) at different time points with a constant series of concentration. To begin with, we isolated the UVECs from umbilical cord vein according to protocol from previous study. Next, the UVECs were validated in our cell culture lab through morphological characterization and CD31 immunocytochemistry ICC marker. The ICC protocol was conducted as followed. Afterwards, cell viability was determined through MTT assay, where the cells were seeded in 96 well plate for 24 hours until they reached 80% confidence. The experiment was conducted with control, vehicle control, and navitoclax treated groups for 18, 24, 48, and 72 hours. Navitoclax concentration from 0.2 to 3.0 micromolar were used. This colorimetric assay is based on the reduction of the yellow MTT to purple pharmazine crystal by metabolically active cells. The quantity of pharmazine, presumably direct proportional to the number of viable cells, was measured by recording changes in absorbance at 570 nanometers using ELISA plate reader. Then dose response curve and IC50 value were determined using graph-bread prism, which is through the dose response inhibition equation of nonlinear regression parameters. Next, statistical analysis was conducted using SPSS, where the mean difference between the control and treatment group was compared statistically using an independent sample t-test. Then ANOVA test was run to compare the mean difference between 4 time points of treatment groups and followed by 2 key post-hoc tests. The difference was considered significant at p less than 0.05. The morphology of UVEC is observed as confluent cobblestone-shaped layers with prominent nucleoli as displayed in Figure 3. Although the morphological characterization showed the UVEC present, cellular marker identification through CD31 ICC marker was conducted to further validate the cells. Figure 4 shows representative pictures of ICC qualitative analysis, where green staining represents CD31 marker, which indicates endothelial cells present, and the cells were stained with DAPI in blue, as well to indicate the cell nucleus. Since the merged images of B and D display most of the cell nucleus was stained with CD31 marker, hence we can conclude that our cultured cells are UVECs predominantly. Next, the best fit of concentration response curve generated by PRISM presented in Figure 5. The results show navitoclax has reduced UVEC viability significantly at the highest concentration used, where 3.0 micromolar navitoclax reduced more than 50% cell viability after more than 24 hours treatment times. And the IC50 value was found to reduce with longer treatment time as presented in Table 1. However, the IC50 for 18 hours couldn't be determined, and this might be due to a limited exposure time with low concentration range used. While in Figure 6, the log dose against cell viability curve were shifted to the left when the treatment time increased, and the cell viability was significantly reduced in 48 and 72 hours post-treatment in comparison to 18 hours post-treatment, reduced by the 2 key post-hoc tests. Lastly, the cell shrinkage were observed clearly after more than 24 hours treatment at higher navitoclax concentration as displayed in Figure 7. We found that the navitoclax has potentially reduced endothelial cells viability compared to cancer cells, indicated by low IC50 value. Our finding comparable to a former study where they reported IC50 value of navitoclax at 0.1 micromolar for 72 hours treatment period. Besides, the navitoclax potency to reduce endothelial cell viability is potentiated as the treatment time increased with much lower IC50 value was determined. Lastly, its effect on UVEX viability is discovered to be time and concentration dependent. As a conclusion, this study reveals the potency of navitoclax in modulating the UVEX viability, and it may suggest a novel mechanism of navitoclax as an anti-angiogenic agent through a regulation of endothelial cell survival. 0.9 micromolar navitoclax for less than 24 hours treatment is relevant for further research to analyze the biological activity of navitoclax in modulating primary endothelial cells angiogenesis. And lastly, it is worthwhile to further elucidate the navitoclax molecular mechanism in primary cells, which is the endothelial cell specifically, and its pharmacological properties to ameliorate the pathological angiogenesis condition. Here are the references.
All right, yes. We open up the Q&A session. Okay, may I ask Prof. Iziza to ask?
Okay.
I think the chat box there, Syahidah is not here, isn't it? Dr. Tan?
Yeah, it's not here. She's
here?
not here.
Is she here?
No, she's having a connection problem.
Oh, I see.
In the chat box.
All right, maybe we hold on for a while. Is Dr. Bedanta Roy is here?
He's here, I can see.
All right, maybe maybe ask Dr. Roy to.
Okay.
Because just now he missed that Q&A session.
Yeah.
Due to some technical.
Dr. Bedanta, thank you very much for your presentation. I have a couple of questions to ask. So first of all, could you please tell this study was done before the pandemic time or during pandemic time? Dr. Bedanta?
Yeah, now I can, because I was not able to even enter now and talk also. Okay, thank you.
Dr. Bedanta, the study which you presented, the study was done before or during the pandemic time?
Actually, this was done during the pandemic time, and it was in the month of December 2020.
Okay. Okay, one more question. So in one of the slides, it was about the ethnical diversity of the studied group. But you didn't analyze the outcome based on the respondents' ethnicities.
Yeah. So actually, sir, this study is means for the students. So they used to do, and I used to guide them, and they used to take health community medicine department for the statistical analysis. So yeah, it is a good suggestion. So if we are doing any further study, we can think of it, sir.
Okay. Okay. Thank you from my side.
All right. Thank you, Prof. Iziza. Prof. Wanami, do you have any questions?
Dr. Bedanta, just wonder, when you show results, the gender is all female. Is it the intention for you to select only female in this study?
No, actually, more are female, not all. So
actually, all are female, isn't it? From your results, all are female.
I will just check, because maximum students, they were female. So maybe there is some biasness, I know, because according to the respond, we have got it, we have done.
Yeah, so that's why I just wonder, because you are studying the effects of the emotional, isn't it? So do you think that
emotional effects actually for females it will be comparatively
So do you think that the gender most likely is going to sort of like affects the results, isn't it? Maybe perhaps the next time for the next study, maybe perhaps there's going to be what they call amount of the gender in the study.
Yeah, because 65% it was women, and so that is the reason maybe little higher we got, and emotionally they are much more like than men. They're more expressible and all.
Yeah, that's the thing. Okay, sorry, sorry, ladies. Okay, thank you.
Okay, thank you, Prof. Panami. Thank you, Dr. Bedanta Roy.
Thank you, sir.
Thank you. All right, I think no Syahidah is here. Okay, judges, any questions for Ms. No Syahidah?
Okay, Syahidah, thank you very much for your study. Very comprehensive and very interesting, especially in terms of the investigating of the new mechanism, isn't it? New mechanism of potential anti-cancer compound. So the first question, is it experimental compound or it was already approved for the clinical use? And the second one, second question, what type of the cancer this compound is targeting for?
This one is actually in a clinical trial for mostly for the solid tumors cancer, and now this drug is in a tumor that target the small cell lung cancer, and also the myeloid leukemia cancer cells.
Okay, the mechanism which just now, a part of those mechanisms which you just now investigated, other additional mechanisms are known for this compound?
Currently, this compound is known to target with high affinity towards the BCL2 family protein, which is the pro-survival BCL2 protein, which are BCL2, BCLXL, and also BCLW. But then there's some studies that use this drug in a combination with the chemotherapy agents, where they see that this drug may also have affinity towards the MCL protein, but then with low affinity. But they try to use this drug in combination with other chemotherapy agents in order to have a synergistic effect on the cancer treatment.
So basically, this drug increases apoptosis, right? It targets the BCL2.
Sorry?
These compound increase apoptosis, right?
Yes.
Yes, so pro-apoptotic. So how to make sure that this effect is selective for the cancer cell and doesn't have any effect on the other healthy cells?
On healthy cells, okay. For now, for the small cell lung cancer study, they also have tried this cancer drug on healthy volunteers, and then they evaluate the safety profile of this drug on the healthy volunteers, and fortunately, the result shows that the toxicity profile that they found in the cancer patients is less severe in the healthy volunteers. So they said this drug safety profile can be proceeded, but then there is one study with the breast cancer cell lines where they use this drug conjugate with the and then they use this drug in a conjugated form, where this drug will only target the senescence tumor cells in the breast cancer. So this is actually like one of the initiative for them to try to minimize the toxicity and the drug specificity on other cells, on other healthy cells.
So this is not quite selective in terms of the toxicity, right? So it's selectively toxic to the cancer cells. Okay, thank you very much. Thank you. That's all from my side.
Okay, thank you. Thank you, Prof. Izzah. Prof. Wan Amir.
Okay, Syahidah, just a general comment actually. Maybe perhaps your slides, the picture need to be much bigger. You know, the one especially when you do, when you show the log dose of this navitoclax and also the picture how the cell is being growing or not, isn't it? So maybe perhaps do it bigger. By the way, just on a technical question, okay? You have shown that you use graphite prism to find IC50 and you use the nonlinear regression and to fit the curve, isn't it? So just wonder, when I look at your graph, do you use 4-point fit or 3-point fit, or do you use non-point restriction when you try to find the IC50?
I used the non-find restriction to find the IC50.
Okay, because there's some effects on your result where, as you can see, one of the results where actually is about 90% inhibition, but somehow the graph actually did not come down. So it might affect your value of IC50. So maybe perhaps you can review back the result of IC50 when you try to fit the what they call using graphite prism, because I suggest you use the at least 3-point fit of the graph when you try to fit the nonlinear regression using graphite prisms. Okay, well done, Syahidah. Okay.
Okay, thank you, Prof, for the suggestion.
Okay, thank you all. Thank you, No Syahidah. Our next speaker, this final speaker, okay, is Selva Kumar from the University of Malaya.
Hi, my name is Selva Kumar Mararaja. I'm from Department of Physiology, Faculty of Medicine, University of Malaya. Today I'm going to present my project entitled Protective Effect of Chloroprothene Raveena against Hydrogen Peroxide-Induced Oxidative Stress on the Reproductive System in Male Mice. Infertility is a major public health concern for many couples worldwide. According to the latest International Glossary on Infertility and Fertility Care, infertility is defined as a disease characterized by failure to achieve a clinical pregnancy after 12 months of unprotected sexual intercourse. Infertility affects an estimated about 15% of couples globally, and amounting to 48.5 million couples. 10% are due to both combinations of male and female factors. 40% are due to female factors, where the remaining 40 to 50% are due to male factors alone. Here is the world map showing the percentage of infertility per region due to male factors. In Asia, it is reported 37% of overall. In 2017, European Association of Urology have reported the causes of male infertility and the percentage distribution in 10,469 patients. 30% are unexplained infertility, 14.8% varicocele, 10.1% hypogonadism, 8.4% mild-descended testes, 3.9% sperm autoantibodies, 2.4% erection or ejaculation problems, 31.4% others. One of the proposed mechanisms for idiopathic infertility is oxidative stress and ROS, reactive oxygen species. The first suggestion that oxidative stress might play a role in the etiology of defective sperm function came from one of the pioneers in modern andrology, Dr. John McLeod in 1943, where, based on the systemic review by Agarwal and the team, elevated ROS has been found in 30 to 80% of male infertility patients. Oxidative stress in seminals develops a disturbance in the balance between the production of reactive oxygen species and antioxidant defense. ROS comes from varieties of sources, such as endogenous sources and also exogenous sources. The principal endogenous sources come from neutrophils, damaged spermatozoa, mitochondria, and macrophages, whereas the exogenous sources come from radiation, smoking, pollutions, and drugs. ROS. At normal physiological level, ROS are very crucial for reproductive function, such as spermatogenesis, hyperactivation, capacitations, acrosome reactions, sperm-oocyte interaction, which is essential to achieve fertilization. However, when the balance between ROS and antioxidant are disrupted, the An uncontrolled of ROS causes oxidative stress that adversely affect the sperm function through lipid peroxidation, protein modification, DNA damage, which will lead to infertility. Here is the conventional treatment of male infertility is used by doctors. However, when this treatment is used for long, we'll have a lot of side effects. So that's why we want to use alternative medicine where we use the natural products. In our project, we use chloroproton brovelinum. It's called Indian ginseng. It belongs to family Oblicaceae. It's claimed as a aphrodisiac and sexual stimulant. It grows in tropical and subtropical climates. It is a phytochemical which contains carbohydrates, fibers, alkaloids, saponins, and proteins. And here is the pharmacological effects, where it has the anti-cancer, anti-diabetic, antimicrobial, anti-arthritic, anti-stress, and antioxidant potential as well. Here is the objective to investigate the protective effect of aqueous root extract of chloroproton brovelinum against hydrogen peroxide induced oxidative stress on the reproductive system in male mice. We will investigate the basic sperm parameters, serum testosterone, FSH, LH, oxidative stress, and steroidogenic markers. Here is the study design. The 8 weeks ICR male mice will be divided into 5 groups, where it will induce with the 2% hydrogen peroxide, followed by the various treatment and CB100, CB200, and positive control DMF 25 milligram. Here is the result, the effect of CB on body weight, food intake, and water intake. As you can see, body weight, food intake, and water intake will decrease on day 7, where the body weight, food intake, and water intake increase in induced mice given CB100, CB200, DMF on day 14. Here is the effect on the sperm count and motility. Sperm count and motility decrease in hydrogen peroxide group. However, sperm count and motility will increase in induced mice given CB100, CB200, and DMF. Here is the effect on the sperm viability. The sperm viability decrease in hydrogen peroxide group. However, sperm viability increase in induced mice given CB100, CB200, and DMF. Here is some representative image of sperm viability. The effect on the host tail coil sperm. The host tail coil sperm decrease in hydrogen peroxide group, but it increase in the induced mice given CB100, CB200, and DMF. Here is the effect on the hormone. Serum testosterone decrease in hydrogen peroxide group, but it will increase in the induced mice given CB100, CB200, and DMF. Serum FSH and LH increase in the hydrogen peroxide group, but serum FSH and LH will decrease in induced mice given CB100, CB200, and DMF. Here is the effects on the lipid peroxide product called MDA. MDA intensity was highest in the hydrogen peroxide group, but the intensity was lower in the treated mice groups, CB100, CB200, and DMF. Here is the effects on the steroidogenic markers. The distribution of the star in the green color relatively low in hydrogen peroxide group, but however, a relatively high distribution of star observed in the induced mice group given CB100, CB200, and DMF. Here is the effect of the steroidogenic marker on CYP11A1. The distribution of CYP rate relatively low in hydrogen peroxide group, but relatively high distribution in the observed in mice given CB100, CB200, and DMF. So as a conclusion, cerebrominal root extract is protective against hydrogen peroxide induced oxidative stress on the reproductive system in male mice. Thank you very much.
All right, thank you. Prof. Iziza, you have any questions for the presenter?
Thank you very much, Selva, for your presentation. I enjoy very much. So I have a couple of questions to ask. The first regarding the method itself. So hydrogen peroxide was given. What the route of administration for the hydrogen peroxide? You gave through the drinking water, or it was given via intragastric intubation?
It was given orally, Prof.
Orally, okay. Yes. Okay, so another question. Which chemical compound, do you think, which chemical compound is responsible for the protective effect of chlorophyllum?
Okay, the reason why we choose this chloroproton brovelinum because of the phytochemical compound, which is highest, we will say the saponin. That is why we choose this chloroproton brovelinum. So that the The saponin, it has a therapeutic activities such as antiviral, antimicrobial, and so and antioxidants and so on. That's why it can reduce the oxidative stress in our project.
So you believe that saponins are those compounds which are responsible for protective effect?
Yes, Prof.
Okay.
Okay, thank you. Thank you. Because of time limit, let us move on to Prof. Amir.
Okay, thank you, Selva. I just wonder, I mean, you say that there is a saponin that present in this plant, isn't it?
Yes.
So is it based on your own analysis or is it somebody else's analysis?
No, we have identified by the LCMS.
Okay, so means you already identify the compound.
Yes.
Okay.
Yes.
Thank you, Selva. Very good presentation.
Thank you very much, Prof.
All right, I guess that would be all. Before we end the session, I would like to invite the judges and the presenters for a photo session. So, can you please stay behind? Can all the presenters perhaps turn on their camera?
Okay, so I'll be. Okay, so 3, 2, 1. Okay.
Okay, thank you very much. Thank you for joining us. I think we will end the session now. Please rejoin us for the subsequent poster session.